Welcome back, beautiful tri-state area. You're listening to a moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, XenSams. Up in just a few minutes in our Going Deep segment in our Expert on the Microphone series brought to you by CO2 Lift. Today, we're featuring Dr. Shino Bay Aguilera, founder of ShinoBayDerm.com and ShinoBayTraining.com. He's a highly acclaimed cosmetic dermatologist, surgeon, and laser expert with over 20 years of experience. He's renowned for his pioneering techniques and has been a sought after speaker at major international conferences. As a top international trainer, published author, and keynote speaker for leading brands in aesthetics, his expertise is widely recognized in the field. Today, he joins me to chat skincare trends, combination treatments, and why pre-treating the skin prior to a procedure matters. We're also going to get his take on carboxytherapy for skin rejuvenation. Now, a one size fits all approach, whether it's for anti aging treatments or body contouring treatments, is no longer the norm. Most clients often want to correct a combination of concerns ranging from wrinkles, sagging skin, and unwanted fat to sunspots, veins, and hollows from lost collagen. No one treatment can provide a client with a solution for multiple concerns. For example, a dermal filler is an excellent solution for treating volume loss, but it's not going to improve the appearance of sunspots. Kybella will reduce unwanted chin fat, but it's not going to improve sagging skin. So, what is there to do? Since utilizing only one mode of treatment may not address all signs of aging, the solution is combination therapy. And this approach makes the possibilities endless and the results dramatic. And the combination of treatment can be customized to address your specific concerns. Today, Dr. Shino Bay is going to join me to chat combo therapy, why no single solo method is an effective approach to skincare, and the newest trend of carbon dioxide therapy for the skin. Welcoming now to the show is my expert at hand, Dr. Shino Bay. Welcome, superstar.
Thank you. Thank you for having me. You look beautiful as always. Always like to do these segments with you and thank you for the opportunity.
Well, you are a trailblazer in your field, a pioneer in cosmetic dermatology and surgery. What inspired you to pursue this field, and how has your journey evolved over the past 2 decades?
Well, I think since I was little, I always wanted to be a physician. And I grew up in Panama City, Panama, and poor. And because of hygiene, I grew up getting carbuncle for uncle, just boils on my face, and I knew how that made me feel, how it affected me. And then you go to your teenagers days and breaking out with acne, and at least for me, it will ruin my day. And just early enough in my career, I knew that I wanted to get into a field in medicine that help people feel better physically and emotionally. So the connection between the primitive brain that is always surveying people's skin to get messages of youth, health, and fertility, it is the perfect field for me because if your skin looks good, you are going to feel great about yourself.
Well, you have your work cut out for you. We're going to add spiritual healer to your journey as well, because you seem to balance it all very nicely, and it always ties back to how you feel within. Now, with your extensive experience, what key advancements have you witnessed in skincare and cosmetic procedures, and how have these innovations transformed patient outcomes?
Well, now we have really smart skincare products out there. It's not like the S and C Pond screen that my grandma used to use. That they're just mainly hydrators, or they stop from the water to escape the skin, but there was not a lot of nutritional value to it. And now we even talking about how certain type of skincare products can work at the gene level, modulate the way your genes work. We also have products that have the language of the cells, the way they communicate with each other. So it's no longer water loss or hydration. We really need skincare products that really make your skin rejuvenate instead of just prevent dehydration per se.
And this brings me to a top trending search. CO2. So when CO2 is used alone or in conjunction with other procedures, specifically CO2 lift, increased skin hydration by more than 117% compared to baseline, with these improvements lasting up to 3 weeks. And the physiological effects also include increases in tissue oxygenation and flow rate and vasodilation, as well as, you know this better than anyone else, neoangiogenesis. Now,
Mhm.
your emphasis on pre-treating the skin prior to procedures is quite intriguing. Could you elaborate on the importance of pre-procedure skincare and how it contributes to obtaining optimal results?
Yeah, it's kind of like the analogy, like if you want to run a marathon, you need to train for it, right? So we ask too much from our all cells. We ask way too much from our old cells to give collagen, to produce elastic fiber, to heal a wound that we create. They are a living entity. So they're all, they require nutrition, they require protection in order to thrive. But what do we do in aesthetic medicine? We burn them, we electrocute them, we stab them and electrocute them, and we ask them, make collagen, make elastic fiber, heal this wound, or pour 50-year-old, 60-year-old fibroblasts. That's what we do. The idea is that with something like the CO2 lift, for example, something as simple as we all understand that bringing circulation to a tissue brings oxygens, nutritions, takes away toxins and waste products. Well, this is a really no-brainer, easy way to understand that this carboxytherapy that we're talking about is actually a good way to prepare a skin that is about to be electrocuted or burn and electrocute at the same time. So I'm big proponent this year to help my colleagues understand that these old cells, they need nourishment, they need TLC, and nobody's thinking that way.
You said it. Wow, that was a great analogy. I love how you tied the two together. And you're 100% right. We know from studies that CO2 increases the presence of wound repair factors and growth factors. And you made such a good point, which help cells turn over faster, reducing the appearance of whether it's aging or scars or stretch marks. And when you go back to stimulating collagen, I've been using this particular product after a breast explant surgery on my anchor lift, and I found dramatic, incredible results. Stimulated collagen and elastin production that promoted a lot of elasticity and helped retain a lot of hydration, even in the areola area, which is crazy to me. And I was quite the studious patient to continue to document my progress with my scars, and I found it phenomenal. So I echo what you're saying. Now, combination treatments have gained a lot of popularity, Dr. Shino, in recent years. What are the benefits of combining different skincare modalities or procedures, if you will, and how do you approach tailoring these combinations to individual patient needs? Because I'm sure it's not a one size fits all model.
No, no, you mean aging is multifactorial, so you need multiple modalities. It's like there's no one single thing that we can call it the holy grail, and everything is needed. For example, I talk about now polyrevitalizing micronutrients. I published this paper out of the United States because we didn't have products like this, and this is about nutrition. Like you actually prepare the skin, you all fibroblasts with the nutrition, cofactors, coenzymes that they need in order to differentiate and thrive so they can perform better after we actually hurt them, with all the things that I mentioned before. For example, if we know like something like the CO2 lift mask, which is a good way to do carboxytherapy because it is a non-inflammatory way to bring the up-regulate the production of collagen. And if I add the nutrition that my fibroblasts or any cells may need, and bringing more circulation, more oxygen. We know that as a human species, we need nutrition, we need oxygen, we need that circulation because its blood is not circulating, the tissue dies. Why do you think that is any different for our cells that we have so much, we have so much from all fibroblasts to do? So for me is if I'm going to do an energy device that I know I'm going to hurt the skin, create a wound, wouldn't be smart to prepare the skin with the right amount of nutrition so they can survive this injury. Also, make sure that there's proper circulation for oxygenation and removal of all the waste material and reactive oxygen species that are formed after you create inflammation. So, having the nutrition with all these products that we have in the market to add local nutrition to the skincare, having something like the Carboxy, therapy, the CO2 lift to enhance the circulation, the angiogenesis, and then bring the nutrition that we're trying to add. Then you understand that your results are going to be superior than you just burn the skin and put Vaseline on top of it or Aquaphor. There's no nutrition in Aquaphor or Vaseline or occlusive products. There's just occlusion, so there's no dehydration, but there's nothing of benefit. That's why you have to think what you want for yourself as a human being. You should want for every single the trillion cells that exist in your body.
Well said. Well, when you put it like that you go to these procedures and they're going to burn you and poke you and do all of that, you make it sound like this product is very much critical and crucial in the process. Now, we know that the positive effects of non-invasive carboxytherapy are scientifically explained, and it's a simple, common Google search that people can do on their own to see that this is non-invasive and almost universally accepted. But carboxy therapy is a topic of interest for many seeking skin rejuvenation. That's one thing. But can you explain how carboxy therapy works and its role in enhancing the results both from surgical and non-surgical procedures?
Yeah, and you know that you never reinvent the wheel, you just make it better. So carboxy therapy is a therapy that's been around for a long time. Maybe new for United States for a lot of people. They may not have heard it, but it's a really good way to increase the level of oxygen, improve the microcirculation on every tissue. When you have angiogenesis, it means that you are forming new blood vessels to feed a tissue, especially a tissue that you're trying to create from genesis, right? Because as we get older, we're just losing tissue. With this product, you actually creating the right properties. You're setting the basis for success in bioregeneration, which is a big topic now in aesthetic, right? You're really creating the right environment for your cells to thrive, and this is a non-inflammatory way to boost your collagen production. But you can use it to prepare your cells before getting any of these aggressive treatments, and only prepare them. You can use it right after to actually support the results, right? Because it's important before, but I believe that is much more important after. If you're sick because you got burned or electrocuted, wouldn't you want to be nurtured and give oxygen and more hydration because you're just being stressed to the max? So I think the beauty with the CO2 lift is like I can use it to prepare the skin for the injury, but I can also use it to heal from the injury. So that's a win-win.
Yep, you said it. CO2 Lift Pro as a medical monotherapy is very effective. It's great for severely dry skin and itchy skin, for the speedy healing of wounds, as you put it, and also increasing blood flow to those areas. But it's also great as an aesthetic monotherapy, right? So fine lines, wrinkles, creepy skin, dark circles, inflamed skin, textural imbalances, dehydration, and large pores. We could go on and on. It's multi use at this point. Now, last question. We have about a minute left. As the founder of both Shino Bay Dermatology and Shino Bay Training, could you share some insights into your approach to education and training in the field of dermatology and how you strive to uphold the highest standards of excellence?
So, man, I hold a lot of master class. I always teach residents, fellows in dermatology, plastic surgery, oculoplasty. I made myself available because we are not making anybody young by using injectable fillers. I want to deprogram them and have them see things differently, the way I explained to you about how we have been treating all fibroblasts without even give them the nutrition and the nurture and the protection that they need as we get older. So my goal is to have them see that the everything is important, but we really need to concentrate on tissue regeneration because we're already there, to use injectable fillers as enhancers, but not as a way to stop the aging process. We're already there. We know how to make every single cell on your body young. That's going to take a few more years in order to know if it's safe. What we need to concentrate now is to marry bioregenerative aesthetic medicine with functional aesthetic medicine, which is everything that we talked today. And I hope that my residents, the people that take my master class, carry this message, and everybody that is hearing me today, that please think about yourselves. They need all the things, the same things that you need, they also need. And if you're going to do all these aggressive things, make sure that you prepare them for them. And then after you do these things, you have the proper post-care treatment so they can thrive.
There, you said it all, my dear friend. Thank you so much for that incredible explanation and answer. We are officially out of time. It was such a pleasure having you on today. You are a great speaker, filled with knowledge, and I can't wait to meet you again in person.
Me too. You're beautiful. I'll see you soon.
That was our Going Deep segment brought to you by CO2 Lift. That was the incredible Dr. Shino Bay. You can check him out on the gram at Shino Bay or Shino Bay Derm. And you could head directly to their website at shinobayderm.com or shinobaytraining.com. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2 Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2 Lift. CO2 Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home Carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase in luminosity, and improve pigmentation, sagging, skin tone, and radiance. For more information or to order CO2 Lift, go to CO2lift.com.